To discuss this topic, which is mental disorders, we have a very, very special person with us. She's a special guest, Dr. Jaya Shukul. She is a clinical psychologist with a huge amount of expertise in depression, anxiety, irritable bowel syndrome, sleep disorders, and pain. Okay, so the first question, which is the most common question which people would search for on Google, are these disorders genetic in origin?
Yes, there are genetic predispositions to all brain disorders that is present. But one thing that we often forget is that these disorders are the one that have developed through childhood and gone into adulthood. And for example, if I have a parent who's been clinically depressed, let's say, or who's been persistently depressed, then the home environment, the learning environment is something that is going to be reflective of that disorder itself. So sometimes, even if you don't have the genetic makeup to get depression, but your environment, there's always that fight between nurture and nature. But if you are being nurtured in an environment which is, let's say, influenced by mental health issues, then there is a chance you will also develop those brain disorders or those mental health disorders, because that's what you've learned, that's what you've subconsciously processed, that's the learning patterns, that's the coping patterns that you've learned in your environment.
Can anger issues be related to mental disorders?
Anger is just a mask. Anger is a symptom. Anger is very, it's a very rare that anger itself is going to be a disease. Obviously, you could be hormonally predisposed, you could have a genetic makeup that makes you more rageous than all the other people. But in a lot of situation, anger, I feel, is just a mask. It's just a symptom of an underlying problem. We see people who are unable to express their emotions adequately, or who feel frustrated, who are neurodivergent. These people, have so much anger, and anger is not just one box. Anger can be a symptom of multiple forms of brain disorders, multiple forms of underlying situations, which could again be biological, they could be social, they could be psychological, or the three of them combined. So it's time we start looking at anger as a symptom and not just as a disorder itself. And let's not normalize anger to great extents that it continues let people suffer in silence. Let's not normalize being angry generationally as well.
The third question is, does depression cause memory loss?
Yes, depression does cause memory loss. It significantly affects the declarative memory, which is the memory regarding facts and events. Memory loss could be of different forms as well, short-term, long-term memory losses. It sometimes also slows down the creation of nerve cells, where we're unable to form new memories or recall memories as well. So depression, yes, leads to memory loss.
Can depression and anxiety cause weight gain or weight loss?
Yes, absolutely. I think it's one of the diagnostics. I know it's one of the diagnostic criterias for clinically diagnosing depression is also changes in the weight. Yes, depression and anxiety lead to weight gain and weight loss uh, directly through the biological sphere as well, or the biological reasons as well. Sometimes because of the medicinal intervention also, and sometimes it's because of a lack of enthusiasm towards pleasure seeking behaviors. It's a social withdrawal that leads to is a result of all of these mental brain disorders. And thus the weight gain or the weight loss again can be due to the social implications, due to the psychological implications, or the biological, or even sometimes due to the interventional reasons that come with anxiety and depression.